Good morning, good morning, good morning. We're glad to be here again to give you a monthly COVID update. I'd like to say Happy New Year to all of you out in the listening audience. We're being live streamed here from the County Commissioner's Office, Liberty County Board of Commissioners. We're running a little thin today. Mr. Brown and I are here to give the report. Normally we would have Mayor Brown and Mayor Baker and Mr. Kenny Houp sit behind us, but Mayor Baker's sick with the flu, so let's wish him well on his recovery from the flu. Happy holidays. Hope everything has gone well for you. Brand new year. More challenges. Since we met last, there's a new variant that showed up that we have to deal with, and we're asking you as a community to remain compliant, if you will, please, ma'am, and please, sir. We're asking you that you would help us to contain it as much as we can, especially specifically here in Liberty County. We know that many of you have traveled for the holidays. You've been off to see grandma and grandpa and auntie and uncles. And there's been some stirring in the population, and stats have shown us that the presence of the virus has increased. So we need you to help us to manage that. We would like to keep our county and facilities open, parks open, all those things that you enjoy, but we cannot do it if we don't have the compliance and cooperation of the citizens of Liberty County, Georgia. So we need that. I cannot express enough how we need you to take your part, play your role, and helping to manage that. You see the news like I do. We still are recommending vaccinations. We still are recommending the boosters. We are recommending parents consider having their children vaccinated, and certainly recommending that you practice the three elements, which is the wearing your mask, and washing your hands, and watching your distance. Whatever you do, please, ma'am, and please, sir, do that. We want to. It's for your best interest that we do this, that we present, and that we come to you to present these stats and this information. We want to keep our county healthy, our community healthy. We want to keep the nation healthy, quite honestly, because we live in a very transit community where a lot of people come and go, so we know that's going to happen, but we cannot stress enough for you how important the role that you play as an individual to making sure that our county is prosperous and healthy. At this time, I'm going to yield to, I always say, he's going to bring the nuts and bolts of where we are, to our very fine county manager, Mr. Joey Brown. Please welcome him.
Hey, thank you, Mr. Chairman. It's good to be back with you. As the Chairman mentioned, and you see on the news, the stats as far as number of positive cases are rising, mostly from the Omicron variant. Let me give you some information for Liberty County. One of the things, if you remember, we monitor is the transmission index. That transmission index is a 4-level indicator of the rate of transmission in your community and statewide. A low is from 0 to 50. To give you some idea where we are, on January 4th, which is the most recent data as of this morning from the Coastal Health District, our transmission rate is 586. So it's almost 6 times a recommended level. The governor at one time had established the ability for local governments to institute mask mandates. That transmission index level was anything greater than 100, so not suggesting there's a mask mandate fixing to go into effect on the county or anywhere in the county, but we are almost 6 times that rate now. Some idea where we were, just in comparison, and it is, I think, related to the holidays. December 22nd, that transmission index in Liberty County was 68. So we've gone in that short period of time from 68 to 586. We continue to climb. The number of positive tests, the most recent data that we've had for that, and the number of testing obviously is ramped up. Our number of positive tests on December 3rd was 3.8%. As of December 24th, and this doesn't even include that New Year's holiday, it's already up to 9.5%. So those are. The rolling average takes a look at the number in a 7-day period of how the averages are increasing. Obviously, those have gone up too. The rolling average as of December 31st for the prior 7 days was around 23.3%. The rolling average up to January 4th is now 44%, so it's doubled. A little more alarming, I think, and we've talked about this before, is the availability of hospital beds, period. Most of those cases that hospitals are seeing are from unvaccinated individuals. Statewide data in the state of Georgia, inpatient beds, and these aren't ICU beds, these are just total hospital beds available inside the state of Georgia. They're at 85.5% capacity right now. So it's a total indication of what the state's doing. The number of ICU beds, which are those critical beds, are at 83%. That's pretty serious. In a conference call a few minutes ago, we do a monthly update with all of our health providers. It has been a problem finding available beds, period. What happens, I think the numbers would indicate, if you look at the percentages, that on the number of inpatient beds, there might be, that, you might say, well, that's fine, there's 15% beds still available. But actually what happens is, in fact, it happens at Memorial and St. Joe's and Savannah and the surrounding areas, is they're going to reserve bed capacity. And so over the last week or so, they've actually been on what we know as diversion, and that simply means they don't take anybody. You cannot get into those hospitals. You can't transfer into those hospitals. Talked with an individual on the phone, hospital administrator a few minutes ago, that indicated they had to contact 70 hospitals in the state of Georgia and in neighboring states trying to find bed space for critical care patients or patients that need to be hospitalized, period, for any kind of disease or any kind of illness. So again, very, very concerning. The state of Georgia is divided into regions for hospitals and emergency services. We are in Region J, which is primarily the coastal region. The Region J inpatient bed use right now is even higher than those two. It's at 87%. Give you these numbers not to scare you, just to make you aware of exactly what's going on in your hospitals, encouraging you to take the steps you need to take to get vaccinated, to do the things I would say that are smart, not to incur any possible trips to the hospital. I know none of us want to do that, but you just need to know that even for regular illnesses at times, there may be extended waiting times, especially at our local hospital. I will tell you that from the EMS perspective, some of those waiting times have increased. As you take a patient to the hospital, if the hospital doesn't have any bed space available, and we actually incurred this a while back also, then EMS is unable to move that patient off of a stretcher until bed space becomes available or until another stretcher becomes available. This not only bogs down waiting time at the hospital, but it also bogs down time on EMS response. So we encourage you to be diligent and just understand really what's going on, how serious it is. We are in current normal situations here at the county. All of our programs, all of our buildings are running wide open. As the chairman indicated, we're gathering some more of this data, continue to look at it to see if we may need to make some adjustments in some of the criteria that we're doing. Vaccinations continue obviously to be occurring. The Liberty County Health Department is performing those. They, from 8:30 to 3:30 on Mondays, are doing vaccinations down here. And then on Thursdays from 8:30 to 5:30, they're also doing vaccinations. The James Brown Park has been hosting a testing site for some time now. They're testing every day of the week, Monday through Friday, from 8:30 to 3 o'clock. As you would expect, they've seen an increase in the number of tests that they're having administered. I think it's important to know that this isn't the only site. If you go to the Coastal Health District website, Google Coastal Health District, you will get an abundance of information related to COVID, statistics, vaccination sites, testing sites, not only in Liberty County but surrounding counties. The last thing I'll share with you relates to vaccines. In Liberty County, those folks that have one dose stands at 33%. It's about 20% below the state average. Fully dosed individuals in Liberty County right now stands at 30%, even lower. Those folks that have gotten the additional doses is 8%. Again, most of those people, if not all of those people, that they're seeing in the emergency rooms here and in local hospitals are non-vaccinated, people that are having to be hospitalized. I will tell you that with the Omicron variant, folks that are somehow getting that variant are not having to be hospitalized. At least we haven't seen any locally. Most of those are being able to be treated at home. So, whether you're for or against the vaccine, I think the facts speak for themselves, and I would just encourage you as a community to be diligent. I would also encourage you to follow CDC guidelines. As the chairman mentioned, you may not have to mask, but I would ask you to do the prudent thing and to mask, especially during this flu season as we got ongoing, and do practice your social distancing. So this time I want to pause and see if we've got any questions that have come across. Michael, do you see any? Okay. Thank you very much.
Thank you, Mr. Brown. As I normally do, I like to end in something that's personal. First, I want to, as I see my fire chiefs in the room with us, as well as leadership Liberty groups here with us. You all can't see them, but they're here with us, and it's great to have them here with us. I want to make a special plea on behalf of the first responders, healthcare workers, all those folk in the public safety area, because listen, you really don't realize how much they've been affected. This is going to the second year now. Every time they go to make a run, go to something, whether it be a fire or a house call, they have to be cognizant of where they are and who they're treating, you know. And that's you will also need to know, if you don't know, also that there's been an increase in the behavioral health concerns among our population. You know, we used to say, we don't say mental health anymore, now we say behavioral health, but because there's a lot of emotional pressure on these people to go to work every day and have to be cognizant of who they're treating and whether they're going to contract the condition, be a breakthrough case, and then of course they have to come home to their families. So it's more than just about you, general public, it's about also those folk who have to take care of you in whatever those capacities are. As a previous healthcare worker, I can tell you I'm still in touch with them. Every day they have to go and they have to take a step back and then go in, okay, we're going in again. It's kind of like going into battle, So it's tough on them emotionally. I promise you that it is. It's tough on our school teachers, the school staff, because they're treating our children. They're surrounded by so many people. So I just want to emphasize to you that it's more than just you need to be cognizant about. It's those people around you, especially those persons who are having to take care of us on a daily basis. I had a missed phone call from a friend of ours who was trying to find a testing site just a few days ago because he had been to a large event, and he has a sister who was homebound, and he wanted to make sure that he wasn't going to inadvertently affect his sister, so he was trying to get a test. And he talked about being backed up to get an exam without having an appointment. So all those are factors we have to factor into where we are now in 2022. So I cannot emphasize enough to you that it's more than just about you. It's about those folk who are on our left and on our right also, and certainly for all of our first responder persons who are diligently working to take care of us every day. So don't forget, let's follow the CDC guidelines at the very least. Let's be cognizant of wearing our face covering, washing our hands, and watching our distance. So until next time, have a great day. Thank you for tuning in to our Liberty County COVID update. Happy New Year to everybody.